Greetings. Welcome to the Ophthalmology Foundation Microlearning Program on Continuing Professional Development Fundamentals. This is Module 1 on Painting the Continuing Professional Development Canvas. Unit 1 about Core Principles and Contributing Disciplines. By the end of this unit, participants will be better able to summarize core principles and contributing disciplines for CPD. The objectives of this module are to enumerate characteristics associated with effective lifelong learning, to compare the conceptualizations underpinning CME and CPD, to identify contributing disciplines, main tools and methods, for CPD, and to explain core principles of effective CPD. This unit will cover three essential topics: lifelong learning, CME and CPD, and effective CPD. Let's get started. Three great drivers account for healthcare professionals' ability to nurture lifelong learning. 1. Continuous advances in the biomedical sciences. 2. Dynamic complexities of healthcare systems. And 3. The importance of furthering humanistic aspects of care. What skills should healthcare providers develop to have a fruitful and enjoyable lifelong learning practice?
Not having an imposed plan.
Good. Not being prescribed a plan, but building it on an intrinsic motivation.
Keeping up with attending conferences.
Right. Planned learning interventions.
We learn a lot from our patients and their contextual needs.
Yes. Workplace context interaction with peers' experience and patients' needs.
I am always excited to put in practice what I learned at a conference or workshop, but the challenge of performing new techniques in practice can be discouraging.
That's a great point. Let's add opportunities to integrate new learning into daily practice. We can also add performance information from a variety of sources to guide future learning and belonging to a community of practice. In summary, effective, lifelong learning should be relevant to practice, requires proactive learner engagement, is enhanced by working in a community of practice, and should be evidence-supported. Definitions of CME and CPD abound. Differences often lie in the perspectives of the various CPD stakeholders: healthcare professionals, educators, regulators, patients, and public and healthcare authorities. Continuing medical education refers to educational activities which serve to maintain, develop, or increase the knowledge, skills, and professional performance and relationships that a physician uses to provide services for patients, the public, or the profession. CME is usually prescriptive, educator-centered, clinical knowledge-driven, and occurs classically at the big conference halls. CPD focuses on the broader context of professional accountability and all competencies required to maintain it. It reflects a deeper and more complex view of what should be included in professional education. Beyond medical knowledge, team building, professionalism, communication, advocacy, scholarship and leadership are competencies needed to advance CPD. These competencies will also be needed as quality improvement, patient safety and artificial intelligence emerge as disciplines within ophthalmology. CPD shifts focus from educator to learner. It encompasses various learning modalities, is practice-based, includes social learning, and requires developing competencies beyond medical knowledge. In summary, CPD is broader in scope than CME and includes several roles and competencies, contextual learning in practice and with peers, and a variety of learning activity formats. This brings us to our final topic. What is effective CPD? CPD systems should enable healthcare professionals to enhance their lifelong learning with their peers, while they practice to effectively meet their patients' needs. Networking and collaborating in multidisciplinary and interprofessional teams fosters interaction, sharing of professional experience and improved performance. Effective CPD should be systematic, comprehensive, accredited, and regulated. Healthcare professionals should systematically create a personal development plan to meet their patients' needs, and respond to their organizational culture. While centered in medical knowledge and skills, CPD should comprehensively include professionalism, communication, team building, leadership, scholarship, and advocacy. Quality improvement, patient safety, and artificial intelligence are emerging as related disciplines and can also be included in CPD. To be awarded accreditation, learning activities should be designed in accordance with adult learning principles within the learning cycle. Clear documentation demonstrates the alliance of trust between society and the medical profession. Society expects healthcare professionals to keep current to perform quality practice. Portfolios, clinical audits, and facilitated self-reflection should be professional duties and receive adequate recognition. In summary, CPD is driven by lifelong learning, and includes and expands CME in learning formats, modalities, disciplines, and venues. CPD that drives change should systematically respect a personal development plan, comprehensively consider a variety of competencies, and seek support on disciplines to perform better in teams and organizations. CPD should be built on learning opportunities following adult learning principles and encompass social and multimodal practice-based learning. Finally, CPD should be documented and regulated. Thank you for watching Unit 1 of the Microlearning Program on CPD Fundamentals. Check out the following resources for more information, and be sure to register for the next module.